Thank you, Mr. Chairman, and thank all of you for being here. This is extremely important. I often say that when it comes to healthcare, all of us in Congress want the same thing. Whether you're a Republican, a Democrat, or an independent, we all want affordable, accessible, quality healthcare. I mean, there's no difference between any party or anyone up here. We all want to have that, and that's why I consider telehealth to be one of the great benefits of our healthcare system. And I think we all realized that during the pandemic. You know, I've always said there's a difference in knowing something and realizing something. We all knew how important telehealth was. We all knew that it was a wave of the future. And then all of a sudden during the pandemic, it became the wave. I mean, it was no longer a wave. It was an integral part of our healthcare system, and it now is an integral part of our healthcare system. And it's very important, particularly for people like me who represent a district that has a lot of rural community in it. I represent the entire coast of Georgia, but I also represent a lot of South Georgia, and there's a lot of rural area in South Georgia, and it's very important. It also helps addressing the healthcare shortage that we have, the provider shortage. The benefits go on and on about telehealth, and that's why we expanded the Medicare telehealth flexibilities during the pandemic, and now they're set to expire at the end of this year. And that's why, along with my good friend from Delaware, Representative Lisa Blunt Rochester, who I've worked very closely with on this committee, and I'm going to miss very, very much when she goes over to the Senate. But we've introduced the Telehealth Modernization Act, and that would, of course, make these flexibilities permanent, and it needs to be passed. And I thank all of you for being here. I want to start with Ms. Ashlock. I want to ask you a question. What would happen in your healthcare situation if Medicare stopped covering telehealth and these flexibilities expired? What kind of impact would that have?
Thank you for the question. The impact that it would have is I would not get the immediate care that I'm getting now. I will have to wait for in-person appointments, and with specialists, that's like 3 months in advance. You know, you have to wait for me to see my neurologist, where we could be having a symptom going on where I need to see the neurologist like yesterday.
Right. Right. Mr. Riccardi, let me ask you, the Telehealth Modernization Act will make these flexibilities or certain flexibilities permanent. What kind of potential adverse impacts or implications for seniors would you see if these provisions were not extended or were not made permanent?
I think, 4 years in, we have millions of people who are entitled to this benefit, and we cannot leave older adults and people with disabilities behind. People are used to receiving this type of care in their home. They're also able to live in different areas, whether it's urban, suburban, or rural. I think it's extremely important that we keep these core aspects of the benefit. There is great promise of telehealth to reduce health disparities also. But I think there also needs to be accountability. We must fund the agencies, CMS, to examine the clinical effectiveness of that. So we'll know what services are high value, high impact, and can ensure quality outcomes.
Thank you for that. Very quickly, with the little time that I have left, I want to talk about the audio-only coverage. Dr. Cunningham, if we increase accessibility, and particularly in rural communities that have limited or no broadband at all, and there are those out there. There are some in my district. I hate to say, but there are. Does this provide an optional or additional option for many older adults who struggle with the technology?
Yeah, thank you for that question. I think this is a question that comes up specifically in rural areas where there is sometimes lack of connectivity or technology barriers for the patients in those communities. I would say, obviously, ideally, we always want to try to do a virtual visit with a video interaction with a patient. But when that is not available, the next best thing is to be able to provide an audio-based visit. And so I think it's really important and critical that we include that in whatever legislation comes through.
Good, good. Mr. Chairman, I want to again thank you for this hearing. What you've heard here, I think, all throughout today proves to us why we need to support the Telehealth Modernization Act and make this permanent. It needs to be permanent. This is an integral part of our healthcare system now, and it needs to continue on. Thank all of you for being here, and Mr. Chairman, I yield back.